Hello, and welcome to the Clinical Liver Disease video series. CLD is an official digital learning publication of the AASLD. I'm Gina Choi, and I'm an associate editor with CLD. I'm here with Dr. Amy Dickey from MGH, who is the author of the recently published EPP-related liver disease patient page. Dear Dr. Dickey, thank you so much for joining us.
It's a pleasure to be here. Thank you.
Thank you. So we're going to get started with just a few questions. The first one is, what is EPP and how can it lead to potential liver disease?
So EPP is a genetic defect in one of the steps in the making of heme in the body. And heme is what carries oxygen on red blood cells. And because of this genetic defect, there can be a buildup of a substance called protoporphyrin in the body. And this protoporphyrin molecule, it looks very similar to chlorophyll, which absorbs energy from the sun in plants for photosynthesis. But in EPP in patients, this molecule protoporphyrin can cause painful cutaneous light sensitivity, and which is the main symptom for EPP, but it is also cleared in the liver. And because of that, this molecule can, in some cases, cause toxicity to liver and cause damage to the liver. Yes.
I see. And could you really just quickly tell us what EPP stands for?
Oh, it's erythropoietic protoporphyria. Thank you.
Okay, no, perfect. I just wanted you to say it, not me. Okay, number two, what regular screening should patients and their doctors consider? And are there any preventative measures to avoid liver damage?
For patients with EPP who have never had any issues with the liver in the past, it's important for patients to get liver function testing at least once yearly. And patients can also get genetic testing to help them understand if they're in a category of patients who might be at higher risk of liver disease. In general, patients' preventative actions include maintaining a healthy body weight, as increased fatty liver can cause damage to the liver. Also get immunized to hepatitis A and B, avoid excess alcohol, and avoid very high dose estrogen contraceptive medications, and that can slow the flow of bile through the liver as well.
I see. So in terms of patients with EPP, do they all see liver doctors, or which type of doctor sees EPP patients first? A primary care, a blood doctor?
It's quite variable, actually. Some there's not very many EPP specialists in the US, so a lot of patients only are seen by their primary care doctor. Some who have evidence of liver disease are followed by a liver doctor, but that's a minority of patients, I would say. Probably 10% or 20% are followed by a liver doctor. But hematologists can see porphyria patients, also liver doctors, geneticists, dermatologists, quite a range. So it's not a specific specialty, but it's very important for a hepatologist to know about EPP because it can cause damage to the liver.
Great, thank you. And how do you know, because you mentioned that there are other things that can cause liver problems like fatty liver, hepatitis. How do you know if liver damage is related to EPP?
First, if EPP patients does have some evidence of liver damage, the doctor can do a lot of screenings to evaluate for other causes of liver disease, such as hepatitis or autoimmune causes of liver disease, and a lot of blood work. And then also an ultrasound can be helpful to rule out other causes. But finally, a liver biopsy can be most helpful deciding if it is EPP liver disease or not. Generally, in EPP-related liver disease, there's protoporphyrin molecule is deposited in the liver. It can also crystallize in the bile ducts and cause cross-like structure called Maltese cross inclusions, and you can see that on a biopsy.
Oh, wow. If liver disease has been established, what is the progression of treatment for those with mild to moderate or advanced disease? What happens to patients' livers with EPP?
For mild to moderate liver disease, there can be various treatments that can be tried to help encourage the excretion of protoporphyrin in the stool, also the help the flow of bile through the liver, and also prevent oxidative damage. And these medications include ursodiol, cholestyramine, cholestyramine, vitamin E. There's not very good data that any of these medications work, but they have pretty low risk. And then for more advanced types of liver disease, really a liver transplant is what is needed for therapy. But to temporize some of the issues in the liver before a transplant, therapies can be tried to decrease the production of protoporphyrin, such as giving red cells to decrease the marrow from making more red cells, also IV heme, also exchanging the plasma and the red cells to remove protoporphyrin from the body. In EPP, only the liver clears protoporphyrin, and so that's the only way it can essentially get out of the body, but it also damages the liver. So you can get into a cycle of increased protoporphyrin, further damaging the liver, and the protoporphyrin increasing further. So it can be hard to get out of that negative spiral. So with very advanced liver disease, a liver transplant is needed, and sometimes a bone marrow transplant is needed to cure EPP to prevent recurrence in the new liver.
Wow. This sounds like a really complex disease that's very important to recognize. So I think it's so great that you're able to write this patient page about this kind of unknown but very important topic. Where can patients go to learn more?
The United Porphyrias Association is a patient advocacy group for porphyria, and they have a website that's www.porphyria.org. I highly recommend going to that page to get more information. I actually am a patient with EPP myself, and I do
Wow.
research on porphyria and very connected to the patient community. And I'm just so appreciative of the United Porphyrias Association, all they've done for patients like me and others in the porphyria community.
Wow, thank you so much for sharing that, and thank you so much for your commitment to this disease and the people who have this disease.
Yes, thank
Um, that was great. I think this is a really complicated topic, and I'm always constantly looking it up again just to make sure that I'm not missing it or anything. But thank you so much for your expertise. Thank you so much for your input, and audience, thank you so much for joining us. On behalf of the CLD team, I hope you found this helpful, and please visit us at www.cldlearning.com so you can access Dr. Dickey's fantastic patient page.
you.